Hello, my name is Dr. Natasha Janke from the Ontario Veterinary College at the University of Guelph, and I'm joined by Drs. Kat Sutherland and Jane Shaw from the College of Veterinary Medicine and Biomedical Sciences at Colorado State University to share with you a communication tool to enhance appointment efficiency. This communication tool is called agenda setting. To transform your practice, we recommend agenda setting upfront every appointment, every time. The authors have no conflicts of interest to disclose. We would like to thank Dr. Rebecca Root-Galley from the Colorado State University Veterinary Teaching Hospital Community Practice Service for her participation in the video example of agenda setting. Let's start off by first answering the question, what is agenda setting? Agenda setting is a series of steps that creates an agreed-upon task list for a veterinary appointment. This list incorporates both the client and the veterinary professional's agendas to build a roadmap for your appointment. Agenda setting is a team sport. Taking a team-based approach to veterinary appointments means that individuals in different practice roles contribute to agenda setting. We will first introduce you to the full process and then examine how to implement a team-based approach to agenda setting. Take time as a team early in the visit to establish a mutual agenda, to structure the appointment, meet your client's expectations, and increase satisfaction. We'll start by looking at the evidence. A core study conducted by Dysart, Coe, and Adams analyzed 334 companion animal appointments to assess veterinarians' solicitations of clients' concerns, which is a fundamental component of agenda setting. There are 4 takeaways from this study that we would like to share with you. Out of 334 appointments, 37% included a solicitation of the client's concerns by the veterinarian at the beginning of the appointment. The first takeaway from this study is that these results identify a missed opportunity to solicit clients' concerns in 63% of appointments. Next, it's important to acknowledge the benefits of agenda setting and why you might want to use this in practice. In that same study, the solicitation of clients' concerns was analyzed to determine how many solicitations were closed-ended versus open-ended. As a quick refresher on these core communication skills, closed-ended solicitations can be answered with a yes or no response. An example of a closed-ended solicitation is, "Do you have any concerns today?" Whereas an open-ended solicitation can be answered with at least a sentence or a phrase, and would be phrased as, "What concerns do you have today?" In this study, roughly 3/4 of solicitations were open-ended, while 1/4 were closed-ended. Let's take a closer look at how clients responded to these 2 types of solicitations. When a closed-ended solicitation was asked, most clients responded that they had no concerns. However, when an open-ended solicitation was asked, only about 1/4 of clients stated that they had no concerns, and 2/3 of clients had one concern to share with their veterinarian. This brings us to the second takeaway from this study, which is that more client concerns are revealed with open-ended solicitation. Many veterinary professionals may be apprehensive about using open-ended solicitations to learn more about their clients' concerns due to the anticipated impact that it may have on time management. Let's take a closer look at the amount of time that the client spoke in response to closed versus open-ended solicitations. We see that clients spoke on average for 5 seconds in response to a closed-ended solicitation, whereas clients spoke on average for 13.2 seconds in response to an open-ended solicitation. Consider whether you have 8 seconds to spare to ask an open-ended question that is more likely to elicit client concerns. The third takeaway from this study is that it does not take much time to fully elicit clients' concerns. A major benefit of agenda setting in practice is the positive impact on appointment efficiency. In that same study, it was found that not eliciting the client's concerns at the beginning of the appointment increase the odds 4 times of a client concern arising during the closing of an appointment. Consider the impact on the veterinary professional who is just about to walk out the door and the client says, "Oh, by the way, I forgot to mention." These late rising concerns impact appointment efficiency, client satisfaction, patient care, and stress on the veterinary team. The fourth and final takeaway is that agenda setting early in the visit reduces the risk of a last-minute concern and facilitates meeting client and veterinary professional needs in a clearly structured appointment. Before we see what agenda setting looks like in practice, let's take a moment to identify where agenda setting occurs. This is the overall structure of a traditional veterinary appointment. Initiating the session includes 3 steps: preparation, introduction, and agenda setting. Once you've prepared for the appointment and introduced yourself, you can then move to agenda setting. Note that agenda setting is completed before gathering information. One of the biggest pitfalls is the veterinary professional's desire to explore a problem and jump into the history before completing the agenda. This approach might prevent the veterinary professional from eliciting the client's complete list of concerns and lead to concerns arising late in the appointment. Once agenda setting is complete, move into gathering information. The agenda items serve as topics to explore during the history. Now that we have covered the evidence of agenda setting and where it should be placed in the appointment structure, let's talk about whose agenda it is. There are 2 agendas in the examination room: the client's agenda and the veterinary professional's agenda. A stepwise approach establishes a shared agenda. The first step is soliciting the client's full agenda, followed by sharing the veterinary professional's agenda, which is likely a step that you and your team are already doing in practice. Next, negotiate a mutually agreed upon agenda and complete the process by summarizing the final agenda. This creates a roadmap for your appointment. Mutual agenda setting encompasses 9 steps, from soliciting the client's agenda through to summarizing the final agenda. We will begin by reviewing the agenda setting steps, provide example agenda questions, and then observe agenda setting in practice. The first 5 steps elicit the client's agenda. Step 1 involves soliciting the client's reasons for the visit. Step 2 includes eliciting the client's concerns for their pet. Step 3 assesses the client's goals and expectations for the visit. Step 4 is a summary of the client's agenda items shared thus far. And Step 5 involves a check for additional items on your client's agenda. How do you know when you have obtained the client's complete agenda? Listen for the magic words, "That's it," or some variation of this phrase that tells you the client has nothing further to add. If the client has not said "that's it," keep checking for remaining agenda items until they do so. To conclude the solicitation of the client's agenda, Step 6 is used to ascertain the client's priority for the visit. Eliciting the client's priority identifies what is most important to get done during the visit and provides a starting point for the appointment when time constraints are a factor. Moving into the veterinary professional's agenda, Step 7 involves sharing your own agenda items for today's visit. Some of these items may align with the client's agenda, and sometimes you will have new additional items to raise. When the client's and your veterinary professional agendas align, there is an opportunity to further enhance efficiency by acknowledging that you are on the same page before moving to the final steps of agenda setting. Next, in Step 8, negotiate a mutually agreed upon plan for the visit that includes both the client and veterinary professional's agendas. Step 9 is the last step, a summary of the final shared agenda, as well as a final check for additional concerns. As we review agenda question examples for each step, note that we intentionally used open-ended inquiry to elicit more information about the client's agenda compared to closed-ended inquiry. Let's start with reasons for the visit. What brings you and Milo in today? If the reason for the visit is already known, summarize what is in your medical record. Alternatively, you can confirm the reason for the visit and invite the client to share more. For example, my notes state that you're here for an annual examination. I'd love to hear, in your words, what else brings you in today. Concerns? Tell me about other concerns you have for him. Goals and expectations? How can we meet your goals for today's visit? Or, to elicit expectations, what would you like to accomplish during today's visit? Next is a summary of the client's agenda. Today we're going to do a complete examination and update his vaccines. You're also worried about how he's moving and he's hesitating to jump, so you want to know how we can keep him comfortable. Followed by a check. What else would you like to discuss during our time together? We will close our client's agenda by identifying their priority. From what you've listed, what's your priority? Now we move into sharing the veterinary professional agenda. In addition to that, I'd like to discuss doing some senior blood work. Next, negotiate a mutual agenda. What are your thoughts about this plan? Finally, end with a summary and final check. We've got a good list, including doing a complete physical examination and updating his vaccines. We'll also have a look into your concerns about how he's moving and his hesitation to jump, as well as what we can do to keep him comfortable, which you mentioned is your priority. Finally, we will discuss doing some senior blood work for Milo. How does that sound? Next, let's watch Dr. Ruth Galley demonstrate the agenda setting process with her client Jane and patient Pearl.
What brings you guys in today?
We are here for our pre-op spay appointment.
Excellent. What else?
I suspect we might want some blood work to prepare for that procedure.
Okay. So pre-op spay appointments and blood work. What else would you like to talk about?
This is going to coincide, I want to talk about nutrition because this coincides with a switch from her puppy, large breed puppy, to, I'm going to move her to metabolic immobility.
Okay.
And then also changes in her metabolic state from her spay. And we have a pretty strict regimen with her and maintaining her weight.
Okay. So kind of pre-op appointment, getting some blood work to make sure that she's okay for that surgery, really chatting about her nutrition and how we're going to maintain a good, nice, lean body mass moving forward, and maybe how to change diet appropriately.
Exactly.
What else?
I think you'll probably, I'm worried about her trust and security. She's been through a lot, and we've spent a lot of time building that trust with her. And this will be her first long time stay with you, as well as biggest procedure.
Yeah.
Yeah.
Yeah, that's kind of scary when you've put so much effort into building that trust with your animal, and then something could break that. That's hard.
Yes.
Okay.
Yeah.
All right. So certainly a pre-op appointment, some blood work, talking about nutrition, how to switch diet, how to maintain lean body mass afterwards, and then also how are we going to help maintain that trust moving forward while she's here, but also moving forward. What else can I help you with today?
Yeah. I think when we had our rehab appointment, when she got her first radiographs, we had like a little bit of a pre-med that we did before we even arrived at the clinic. And so related to her trust, I'm wondering if that might be something that we could consider, that she comes in even with that on board before.
Okay. Good. Yeah, we can certainly have that conversation and see what she had before, or talk about how that worked for her.
Okay.
And see what we can do to help with that. Okay. What else?
I think that's my list of concerns.
Okay. So potentially medication to maintain that trust, making sure we're talking about diet change and then nutrition and maintaining lean body mass after post-operatively or after the surgery. We want to talk about the surgery and maybe get some blood work just to make sure everything's okay. What did I miss out of that list?
I think you've got it.
Okay, great. I heard you say do you have some concerns around surgery, tell me what worries you?
Well, two things worry me. Of course, the anesthesia and the surgical procedure itself and the risks associated with that. And then her more on the behavioral side, right, is her feeling secure and trust and not breaking the bond that she has with you all.
Okay, great. So those are certainly legitimate concerns, and so we'll have a conversation about how we can make it as safe as possible and ameliorate any of those issues at all. So, what are your goals for this visit?
I think to leave with you kind of giving me a little bit of a walkthrough of the timeline. So what do you need me to do before? What's the day of going to look like? What is the post-op going to look like? She is incredibly active and athletic. And so how do we manage that in the post-op period?
Excellent.
Yeah.
That's important. Yeah.
Yeah.
Okay. So really having a good conversation around pre-post-op, what that needs to look like to make everybody heal well and safely, but not lose our little puppy brains since we're
Exactly.
with the active dog. Okay. And what would your priority be for today?
The most important thing is probably what we talked about around trust. Yeah. And a close second is keeping her safe.
I think those are great priorities.
Yes.
All right. So I personally, as a veterinarian, would agree with that. We have a good plan moving forward of what we would like to get done today. I don't really have anything to add to it other than we are going to have to, I'm going to need a little bit more information from you
Sure.
to be able to figure out how we can actually work together to move, one, her safety priority along with making sure not only is she safe physically, but safe mentally as well.
Yes. Okay. That sounds like a good plan. Thank you for being on the same page.
I try.
Yeah.
Now that we've seen agenda setting in practice, we want to walk through agenda setting as a team sport. Depending on your practice and the level of team-based veterinary care, different practice roles contribute to agenda setting. Let's see how team members can work together to solicit the client's agenda. Step 1 begins when the client books their appointment and the client service representative gathers the client's initial agenda, making note of it in the medical record. Step 2 is when your client comes in for their appointment. The veterinary assistant or technician starts by summarizing the agenda items from the medical record and elicits the client's agenda to capture any new items. Please note that if you are taking a team-based approach to your appointments, it is extremely important for the veterinary assistant or technician to relay the client's agenda to the veterinarian. Then, at step 3, the veterinarian summarizes the agenda items back to the client and checks for accuracy and elicits any remaining items. The sharing of the veterinary professional's agenda and negotiation of a mutual agenda may occur with either the veterinary technician or assistant or the veterinarian. Considering that agenda setting is a team sport in many veterinary practices, it is important to train all client-facing roles in the agenda setting process. In a recent study by Janke, Shaw, and Co. that examined the impact of on-site communication skills education conducted with veterinary teams, it was found that in the 85 appointments conducted before the team received communication training, only 38% of visits included a solicitation of the client's agenda. This is comparable to what Dysart, Co. and Adams found over a decade prior. You can see here that 3 components of agenda setting, solicitation, summary, and checking for remaining items, increased significantly after the practice teams received communication skills training. The takeaway of this study is that agenda setting can be taught and learned. Future research is needed to further examine the impact of agenda setting on outcomes such as appointment efficiency and adherence. We would like to end with a few key take-home messages related to agenda setting. First, front-load your appointments by soliciting the agenda at the beginning of the visit to enhance appointment efficiency and reduce odds of late arising client concerns. Second, use the core communication skill open-ended inquiry to elicit more client concerns compared to the use of closed-ended inquiry. Third, agenda setting is a team sport. Multiple veterinary team members can elicit the client's full agenda. And finally, invest in developing your veterinary team's communication skills, which has been found to improve the implementation of agenda setting in practice. If you're interested in learning more about agenda setting as a communication tool to enhance appointment efficiency, please see the book Developing Communication Skills for Veterinary Practice by Shaw & Co. 2024. We hope this video manuscript has been a useful introduction to agenda setting, and we encourage you to try this communication tool out in practice.